I first came across Jilifi through Miss Catherine Holder.
My son met the family on Fortuna through his studies with Sydney University and was welcomed so much by the family, and he just knew he wanted to help Jilifi.
They realized that he's got a enormous growth on his right side of his face. They were very concerned because through the few months that they're with Jilifi, he's getting weaker and weaker and having issues eating and drinking. Jilifi's got a 12-year-old, 9-year-old and a 4-year-old and a very tight family.
They say he will go back home and stay with his family, wait to die. Yeah, that's all. So we stay, no plans, because Jilifi wait to die, so we don't have plans, so we just wait until Jilifi die.
Hence that they reach out to pretty much surgeons around the world and see who will help Jilifi through this removal of this facial tumor, which was consuming him at the time.
Dr. Cheng replied, and in the email he said that Jilifi would be his 2019 pro bono case if we could get him here to Australia. And with the support of Ashford Hospital, Jilifi will be having his surgery here in Adelaide.
Well, it's been a long journey for Jilifi to get here. It takes a lot of generosity from around the community, individual donors. When Jilifi arrived in Adelaide, which is in around late February, he came to my clinic the first day. He has his scarf wrapped around his face. He was very shy and he's obviously in pain. So through my examination, he does have a large tumor which pretty much extends from the base of his skull, involving his eye socket, cheekbone, and the lesion actually has deformed his lower jaw because it's been growing for 13 years. The CT scan has shown that the tumor has not invaded Jilifi's brain. However, it's separated only by his dura. The company Stryker has kindly donated their expertise in 3D planning, so we were able to upload the Jilifi CT data into their database, and we're able to plan Jilifi surgery in a 3D environment. The 3D planning allow me to be able to visualize some of the vital structure, and we can design all the surgical cuts without actually interfere with the vital function of Jilifi's eye, his facial nerve, and also around the back of his throat in terms of swallowing and talking. We're also able to obtain a CT scan of his leg, and which we can reconstruct his defect after I remove the entire tumor. I was very lucky that Ashford Hospital has allowed me to perform the pro bono surgery for Jilifi. Basically, it has taken 21 hours to complete the entire planned surgery. The reason for taking so long is basically not only the removal of a tumor involves the base of skull and also most of the major vessels of Jilifi's neck. It also involves the dura surface of the brain, which sort of has to take a careful dissection to enable us not to breach the dura. The other time that takes longest for the surgery is actually the reconstruction of his middle of his face. This requires taking the side of his leg and with the fibular bone and we have to section the bone into 3 segments to be able to reconstruct the nose, the cheekbone, and also his zygomatic arch. And this actually hopefully will give him the adequate facial aesthetics in the future, so he doesn't have to wear a scarf around his face anymore. The surgery wouldn't be possible without the help of all the doctors involved. I just want to put a special thank you to Dr. Peter Devenish, who's my anaesthetist that I work with all the time. He has done an excellent job to keep Jilifi healthy through the surgery of 21 hours. Jilifi has done extremely well post-operatively. He was in ICU for around a week. This allowed him to have daily blood tests. He had IV antibiotics, and he gradually recovered from his initial long surgery. Overall, I think we achieved a great outcome for Jilifi. We managed to remove the entire tumor, and the pathology report has confirmed that it's a benign pathology, which means that he will have a good long-term outcome. And we also managed to recreate his top jaw with an obturator, which means that he will have teeth to chew, and he will also have a palate to be able to pronunciate. He will be able to drink, and he will be able to swallow. So I think overall it's a success.
Every time I feel not good, I want to sleep. I had to make a lot of work, but after operation, I feel good now. So when I have a thick tumor, I thinking one day I will have a good life. But I thank you, Dr. Chu, to help me to make my dream come true. I don't believe that I have a second chance to live. But thank you for Dr. Chu, and he want to help me to fundraising to make my road in here. I thank you for all of to help me.
Jilifi has recovered remarkably well. He is in good spirits, and he's ahead of his schedule in recovery and obviously leaving the hospital early. So it's so fantastic. It's a miracle for all of us.